I'm Dr. Carolyn Mach. I had worked at Woodside Health Services, Jordan Health Center for 41 years and as a staff family physician. And I retired on December 20th, 2019 and came back to work on March 15th, 2020. So I don't have a regular patient panel. I was asked to come in to see Dr. Lori Donahue's patients while she was on leave from her clinical practice to concentrate on the administrative work for how we handle COVID-19 pandemic. So I have been doing some in-office visits and as well as telephone or video visits. I think the telephone visits are very helpful in terms of just touching base with patients, but there's obvious limitations. I can't see them. I do a limited examination if I can see them in terms of just having them move around. But obviously I can't listen to their lungs or feel their body and see what's going on. So I think it's very, very important to encourage people that if we let them know that it's reasonably safe to come in, that they should keep up with their office follow-up visits.
So my name is Maya Reagan. I am a front desk receptionist at Brown Square Health Center. So I've been at Brown Square and Jordan for about 2 years now. So I've had patients who have, come across having, friends or family members who have tested positive that they were actually around without them knowing that they were positive. And that caused a lot of anxiety for a few of them. So they have had, a few issues in terms of their mental health with that. I've had a few patients who've had difficulty getting food that we've gotten in contact with the social work here, and they've been able to get food through them, which was a big blessing for them. So they've been really appreciative of that. Other than that, I haven't had any other experiences in terms of obstacles with COVID and, being able to have a place to stay or anything like that. I haven't heard anything like that.
My name is Lakia McKelvey. I'm a licensed practical nurse here at Anthony Jordan Brown Square location. I've been at Brown Square for about 1.5 years now. I feel like I've been seeing some anxiety about what's going on in our community right now. A lot of the patients have questions about how long this is going to carry out and what role they can play in helping others. A lot of what I'm seeing though is a lot of anxiety. What we have been doing is sending some letters out just to say hello and how are you doing to some of our patients who we haven't heard from, and we just want to check on their well-being, just to say hello, just so they can still feel connected. A lot of our patients may not have families, and we are that connection piece for them. So being that they're home a lot more now and not coming out for those maybe smaller needs, those appointments that maybe like small BG checks or blood pressure checks, they may be staying home doing those things on a televisit now. So they're missing that connection with the person to person. So I've seen a lot of our staff members like send out letters, even sometimes call just to say hello and see how those patients are doing. There's a lot of our patients that may be experiencing a lot of mental health challenges right now and not being able to come in and talk to those counselors and have those face-to-face meetings like they're used to. That could be very challenging for a lot of our patients. I think the community should know that the small health facilities, healthcare centers like us, that we are also on those front lines, being faced with the same challenges that these big hospitals are. Like I hear a lot on the news about the nurses in the hospitals and not a lot about the small healthcare centers like Anthony Jordan, where myself and my staff members, our co-workers work at. Like it's not a lot of talk about those small healthcare centers that meet those very important critical needs of those neighborhoods and those people. And we too we too would like to be, recognized as being on those front lines. And we have families that we go home to and that we hold very dear to our heart, and so do our patients. And so it will be nice to be recognized as a whole healthcare facility, and not just the hospitals, but also the small healthcare centers like ourselves.
Okay, my name is Maria Lino. I'm an LPN. I'm at the Woodward location on Genesee Street. And I've been here since October of 2019. I'm pretty lucky. I get to work with most of the providers. So I'm family medicine. I've heard several patients say, "Oh my God, thank God, because I couldn't make it, if I had to come in," and so forth. Or there are patients that have difficulty with childcare, so it's easier for them to have their appointments at home. I have a provider who's like, his patients really, really trust him, so they really like talking to him on the phone. Like, they were very comfortable. And we always ask, like, are you comfortable? Are you somewhere where you can talk? And they always be looking forward to their appointments over the phone with him.
My name is James Wilson. I'm a nurse here at Woodward Health Center, the one located on 480 Genesee Street. I've been here for a little over 4.5 years, and I work in family medicine. I see, I would say, fear, which I understand, they're trying to get in and out, because of the fear of being in contact with someone. In-person visits before, the pandemic, we were packed, the schedule was full, they have to wait maybe the next day or the day after that. But now with the telehealth, it's a little more easier. The patients do love that. They love that they can talk to their doctor, and sometimes also it helps too, because I feel like they're more open over the phone than in person. So they do share things that we're like, wow, they never said that before. All the times the patient came in, they never said that before, or this is something new that's been too new to us, but ongoing for them. So they're able to share more over the phone. Some patients, they feel ashamed with certain situations and things that, they may be doing. And I think over the phone really helps them. Even after this pandemic, I feel like telehealth should still be around. We should still use it more often, because also we have patients that, that they would rather talk over the phone or have the video message than to have, come here to the office and talk to the doctor. Yes, we're doing things that we wouldn't have never even thought of or did before. So to, certain things like med refills, we're able to communicate better with the pharmacies, with the patient if they need certain med refills. It's already easy to do a med refill, but let's say if that medication isn't working, they want to try something else. Telehealth is good. Over the phone is good. So it's certain things where the patient don't actually have to come in, but it'll be good for them to speak to their provider when they need to. So what I see on the news and here in our community, as well as on social media, is that yes, it really is affecting our patients. I feel as far as the need for like testing, I'm first want to say thankful that we do have a respiratory clinic. I think that is awesome. We just started like last month. It's been booming. We've been getting a lot of patients in that they, if they have any symptoms as far as COVID, they're able to be seen and to get tested right then and there.
So my name is Laverne Jones. I'm the clinical services manager for Jordan. I also practice manage at our Glenwood and Kennedy Towers locations. I've been with Jordan since March of 2017. In the respiratory clinic, we're supporting patients that have respiratory symptoms while dealing with the COVID pandemic. So it could be that, they're just asthmatic, or they have COPD, or it could be that they have symptoms of COVID, or that they have had possible exposure to COVID. So we have them going through our respiratory clinic, which is located at our Jordan Center location. just to make sure that everybody's safe, keep our patients safe, keep our employees safe, and that they can get focused care in the respiratory clinic. So those are the type of patients that, we're serving there. I think they're coping the same way that we're all coping, kind of trying to stay up with all the changes while dealing with very real realities of possible unemployment. It could be childcare concerns due to kids being out of school or daycares being closed. It could be, finances because of the unemployment or because the kids are home, how am I going to feed my kids? It could be, loss of housing. So we're all dealing with those very same realities, but, trying to cope the best way we can. And sometimes it's not coping so well. Other times it's, yeah, I'm doing okay. So it's the same way we're feeling is the same thing that we're seeing in our patients. So in our respiratory clinic, we do have the ability to test our patients for COVID. And that always brings anxiety. It's always, what if I have it? What if I have it? So, as caregivers, we're trying to help our patients get through those very real fears while, we're afraid at the same time. So, operating from a space of, I feel the same way you can. We're going to deal with it the best way that we possibly know how. For me personally, I just try to roll with the punches, and try to lead the teams that I support from a place of knowing we're all dealing with the very same realities. So, having some patience, some understanding, and taking the time throughout the day to just take those deep breaths to say, you know what, I got this. I'm okay. I don't know what the future holds either for work or home, but we're going to make it through. I just think the work that Jordan is doing as a whole is amazing. We're always here to serve our community, and it's just amazing to be a part of it. I knew when I picked Jordan what the work was going to be, and the focus hasn't changed, and I'm still happy to be a part of the team.